We've made a lot of good progress in the fight against COVID-19 recently. Things have gotten so good. People are suggesting we're moving now to an endemic. What exactly does that mean for you? To answer that and more questions about getting to the other side of the pandemic, we have Dr. Jay Wyatt, the Chief Medical Officer at Moses Cone Hospital, with us until 6 o'clock tonight. To start, we're going to start by kind of talking about the whole pandemic-endemic thing. So what is the difference when people say pandemic versus endemic?
Thank you for having me, Tanya. And I'd like to say first off that on March 11th of 2020, the World Health Organization declared the COVID-19 a pandemic. Since that time, we have been in a pandemic and we still are. What will keep us in a pandemic are high rates of the disease throughout the world, and especially in certain areas. We get to an endemic state when the rates are low and manageable and have remained that way for a period of time. We're not near that point right now. There's still, even though we have come down a lot, there's still a lot of disease still out there.
We are definitely making strides, and it seems like we're starting to get out of it. It will be so nice once we actually do get there. How would living in an endemic state of COVID be different from the past 2 years? Would we still need masks? Would we still need vaccines?
I think the only way to get to that endemic state is to continue to try to get as many vaccinations as possible. Masking will probably not be necessary in an endemic state, although for an endemic disease such as the flu, we saw over the years when we were masking because of COVID that it did help with the flu also. So although it won't be mandatory or required, it can still help in certain situations.
All right, so if we're not in endemic right now, what steps do we need to take to get there? And is some of it just time and it running its course?
Time is certainly a part of it, but the more that we can do to boost vaccinations, the faster we can get to an endemic state.
All right, so let's talk about this. Could the virus return to a pandemic level once we actually get to an endemic level? Does it make that kind of turnaround, or once it gets to endemic, are we done?
Well, that sort of depends on the virus, unfortunately. As you probably remember, starting with the original coronavirus infection, we went through a surge and then it came down, and then we had the Delta variant, which went up and came down, and then we had Omicron. So it really somewhat depends on whether or not there's another variant out there that can cause us to bump up again. And certainly if we have one that is very transmissible and the vaccination rate hasn't gone up, or if it turns into a variant that is somewhat resistant to the vaccine, then we could see another surge.
Okay, let's talk about where we are right now. I know that, you know, a lot of people are doing without the masks and that kind of stuff is happening in our community. Cases still remain high in unvaccinated folks. People see breakthrough cases and they question, should I even get vaccinated? What do you say to those folks today?
I say that it still can be a very deadly disease, and if you have the opportunity to mitigate against the symptoms and the problems associated with getting active COVID infection without being vaccinated, you should take advantage of that. Even though you can still get the disease, the chances of your having to be hospitalized or have severe disease is significantly decreased.
All right, so folks who, all right, maybe past the point, maybe they already got the vaccine, but they're like, all right, things are getting so much better, I don't need to get the booster. What about the people that way, who are thinking that way?
They don't need what? I'm sorry, I didn't hear
that they
the
don't
last
need the
part.
booster. They've maybe got vaccinated, but they're thinking, oh, things are getting so much better, I just probably don't need the booster.
I believe that any augmentation of your immune system can be an advantage, and certainly a booster offers that. So I would encourage people who've had their 2 or maybe their 1 to go ahead and get a booster because it only can help you, it won't hurt you.
Okay, let's talk about the status, the vaccine for kids, kids under the age of 5. How can we protect, as parents, their kids in the meantime, and what do we think is going to happen with a possible vaccine for kids under 5?
So vaccines are all about risk versus reward, and right now they have not been able to necessarily find that balance where the reward is great enough for kids less than 5. So until then, until we get to the point where we know it's going to be safe and offer the same advantages, masking, hand washing, social distancing, all the things we were doing before can be utilized. But under the current environment where kids are starting to go back to school, making sure that outbreaks are handled in the proper way and people are quarantined when they do become symptomatic.
Okay. All right, so Dr. Wyatt is going to be back with us for 2 more segments, and this is, again, your chance to ask him your questions about the state of COVID and things that are going on. We want you to be able to get your answer in real time, so this is what you need to do. You need to text him your questions, 336-379-5775. You can text them right now. We're going to be back in just a few moments.